Any moment now is going to start announcing measures which he says will help control the number of immigrants coming into the country to live and to work.
So we're going to go through that door and into the press conference where, there we go, there's the podium, and we're expecting the Prime Minister to arrive in the next couple of minutes. Of slogans securing Britain's future.
Today we publish a white paper on immigration, a strategy absolutely central to my plan for change. So as this white paper sets out, every area of the immigration system, work, family and study, will be tightened up so we have more control. Skill requirements raised to degree level. English language requirements across all routes, including for dependents. The time it takes to acquire settled status extended from 5 years to 10. And enforcement tougher than ever, because fair rules must be followed.
Migration, migration, migration. Hot topic of the country. Legal migration, illegal migration. Get fire on the subject. Welcome back to Mundy House Heart of Care YouTube channel. In this episode, we're going to explain our government's new migration policy, the white papers, passing as a law or not, we don't know yet, but we want to explain how this is going to affect the care sector all over the country, because the care sector is going to face and challenge and suffer. You may be wondering why I am talking about white paper policy, because this may be not affecting Mundy House. This is not a Mundy House issue. This is a general issue. This is a whole country's issue. This will affect the carers all in our country. That is why we are explaining this. So maybe some of you think, oh, what is this about Mundy House? It's, of course, it affects Mundy House and so many care homes all over the country. So that is what we are explaining in this video. Why the government focusing on reducing migrants, net migrants numbers? It is very interesting. They are actually looking to reduce the legal migrants numbers, whoever come here invited by either by the government or employers. They want to control the people who coming into this country. It's fine, but where is the human resources to fill that welcome area? So how are we going to fill the gap of these skilled people? Legal migrants come from all over the world. So now we are saying we're going to control them. How are we going to control them? There are at least 5 or 6 new proposals to reduce the net migrants. First of all, it is the highly skilled visa holders must have pass good English, RQF6. It is a degree level English language test, and there is strict dependent visa restrictions. The care visa comes under tier 2 skilled worker visa. There were a huge number of people come into UK after COVID. There were lots of employers recruiting carers from abroad, Asia, Africa and so many countries. And so they are all going to face this challenge. Another important proposal is the carers from abroad, they cannot bring their family. The husband cannot bring the family, the wife cannot bring the husband. They can't bring their children. They are working hard here for their family and they can't see their family because of the new rules. I know it is government's new proposal to reduce the net immigration, but government has to find some way to support the people who come here and work hard and giving their life in this country for the community. We need to respect that. Another hit to the care staff in this country at the moment, the ILR, Indefinite Leave to Remain, period is extended or extending to 10 years. They were expecting after 5 years they're going to get their ILR, Indefinite Leave to Remain, in this country after 5 years. It's not going to happen. Where is their human rights to have that 5 years ILR? Government is extending to 10 years. Why they need to wait for 10 years? The problem is these good carers, the skilled workers, they're giving their life. They may leave this country to another place, Canada, Australia, New Zealand, many other European countries waiting for the carers. So government has to take a good decision on this, whether they pass this law or not. They have to consider the people who are in this country at the moment. Maybe they could impose these things, whoever coming into this country in the future. Okay, do that for 10 years, 15 years, no problem. But whoever in this country, they're working hard in this country, they have an expectation within 5 years, they're going to be permanent in this country. They're giving their life. So please, I think the government needs to consider this ILR period to stay to 5 years. Most of the carers came into this country last 5 years. They are actually highly skilled people. There are engineers, there are graduates, there are so many highly educated people, IT people, they are all working in care. What do you think? They have to wait 10 years to get their ILR and then stay in the same job for 10 years. If they could get ILR within 5 years, our country will get more high skilled people in other areas as well. Also, we can train, develop our native employees as well. So it is very important to give ILR to the current staff in this country who are working in care, NHS, care homes, in any healthcare sector. That ILR period should be 5 years. But at the end of the day, the government is going to decide. We can't question it. But if the government deciding it, there should be some human values, human support in there. We are all humans. There were thousands of care staff sponsored by fraudulent sponsors since COVID time, because the government was authorizing license, COS license, so many organizations, and they bring so many people from all over the world into the country. But the government did not look into who is coming here, who is sponsoring, where they're getting job, but nobody looked after them. They were cheated by so many fraudulent sponsors. I know now government is revoking the sponsorship license of fraudsters, but it is too late, because so many people from all over the world, they were cheated. Where is their human rights? Who is going to hold their human rights? And then who is going to help them? The government has the responsibility for this, because they are the one given this sponsorship license to so many fraudulent sponsors. UK care sector always relies on international care workers. The NHS hospital relies on international care workers. If you look into the nurses, the consultants, many top people are in NHS and care home staff. They are all overseas workers. So if the government imposes this new law, what is going to happen is there is a big shortage of care staff. Where are we going to fill this gap? And there is not many people coming into the care sector nowadays. Who is going to recruit staff for care sector and NHS? Our people will get distressed, and our elderly people never get the quality care, because we always rely on international, overseas, migrant care staff. That is what we're going to stop. The government is going to stop them. I know, I understand this is to help our country's migration, but is it legal migration we need to stop, or we need to look into the illegal migration, the biggest problem of the country? There are hundreds of illegal migrants coming into the UK as asylum seekers, refugees, through the Dover, from France, and all over the Europe. That is the way they can come into the UK, they can get what they want, because we are a humanitarian country. We uphold people's human values, human rights. Yes, that is good, fine, please help and support them. But how do we integrate them to our community and our system? How do we employ them? Can they come and work in care homes? Can we give training and development schemes for them? How long it takes them to be legal here? No problem, people can come into our country and get a nice life. People who coming here legally, like care staff who have a 5 years visa, and that is going to be next to 10 years, and then saying you can't bring your family here. So that is really not fair to the people who work hard, and they are all giving their taxes and everything. They pay rent, they pay taxes, they give their life. So who is going to support them? This is a very important fact. Carers and care sector, it's not just a job, it's not an employment, it is a humanitarian sector. It is for kindness, compassion and love. And that is what you're spreading to our people, to elderly people, to any people who lives with the difficulties. That is where all these carers coming and spreading, stretching their hands, their care, their heart they're giving to them. Is government actually kind to them? Is government actually kind or hostile to them? Please don't do that, because they are the one looking after our elderly, and this is our future. So we need to look into this very seriously. So the government published white paper on cutting down the net migration on legal migration. Okay, we are expecting the government is going to bring a white paper on cutting down the illegal migration as well. That is the only way you can save the future of our country. Restrict, we have to manage the people coming into this country illegally. When I come into this country, I started my career as a care assistant. Then I developed myself because there was lots of opportunities. There was a ladder to climb in care sector. I become the deputy manager, I become the home manager, and I am inspiring so many of my carers. They all have their own dreams to develop in this career. They wanted to be, one day they wanted to be a team leader, one day they wanted to be a deputy manager or a care home manager or something else in care sector, in NHS. They can do. So many of my staff transferred from our care home to they found development, career development, and they went to NHS. There is lots of people actually, we give them, we trained them, we made them skilled people and then went to NHS. So they all have their own dreams. With this new proposal, bringing down their dreams, shattering their dreams. Everybody have dreams, so we have to support them to fulfill the dreams. And to the new people who wanted to come to this country and wanted to do a job in care sector, you have to go through the legal channel. Please don't give your money to fraudulent sponsors and they will offer you job, but they never give you actual job. So then you have to come here and then you never find a job. You don't even find a sponsor. So that is going to be a big deal. They are ghost. There are ghosts everywhere. So please don't go for the fraudulent sponsors. Just to go and check the government website, Gov.uk website, and then you can go through that properly. If an employer wanted you, they will recruit you, they will do the proper DBS and they will do the references and everything, and you have to go through the proper channel. Please don't give money to anybody and you don't come here, because there are lots of people cheated by these ghosts. Finally, the white paper. Is this white paper going to be a law? We don't know yet, but there will be some changes in the care sector. So we need to wait and see what the government is going to look into it. They are collecting some feedback from several employers, several people, how this is going to affect the care sector, the health sector. So we don't need to panic. We will wait and we will see what is going to happen. And I hope the government will understand the complexity and the skilled worker shortage in the care sector, and hopefully they will support physically, mentally. Everyone has got some talent within inside them. They want to develop it. They came here because from abroad they come here, it's a dreamland. The government has to rethink and then support the people who work and live and giving their life into this country. The white paper may or may not be a law, but there may be some changes, but our carers has to go and face this. And I hope they will support the care people, the carers who giving their life to all of the people in the UK. So please don't worry, the white papers, maybe it will become a law or not. Please like, share, subscribe our channel. This is your channel, Heart of Care.
Thank you, Madam Deputy Speaker. A place where so many people from around the world have chosen to make their home. A place where so many people contribute to our community day in, day out. Since this announcement, Madam Deputy Speaker, I've been contacted by several constituents who are currently on a work visa and looking at their path for a way for indefinite leave to remain. They are understandably worried, Home Secretary, about where this uncertainty leaves them. They're worried about their future plans and whether this policy applies to people who are already living and working in the UK, or will it just be to new visa applicants?
Home Secretary.
Well, thank the honourable friend for her question, and she is right to say that there are people working in all kinds of jobs across the country, contributing to our economy and to our communities, who have travelled here from all over the world, and that was hugely important. We will set out further details of the earned settlement and citizenship reforms later this year, and we will consult on them. So there will be plenty of opportunity for people to comment on and consider the detail. But it is important that we have extend the sense of contributions and the points-based system to those reforms as well. We have also said that we will maintain the current 5-year route for those who have come on a dependence visa, on a family visa as well, as part of maintaining families.